Hi, everyone. Welcome to City and State's latest state legislative forum with today's event centered on the Hudson Valley. My name's Kay Dervishi. I'm a staff reporter with City and State. Also very excited to be coming from the Hudson Valley and moderating this panel where we'll be hearing all of our legislators' top policy priorities, particularly in issues affecting seniors in New York and in the region. Before we get started, I'd also love to give a thank you to today's event sponsor, AARP, and also to point out a couple of functions that are important for our audience members to know if you're logging in and viewing us on Zoom. If you're interested in asking any of the lawmakers attending any questions, there's a Q&A button at the bottom of your screen. I'll try and take questions as time permits, and feel free to upvote any questions you find particularly interesting, so that comes up on the priority list. And also feel free to interact with other webinar attendees in the chat function, also at the bottom of your screen. Just please make sure to use the drop-down box that allows you to share comments with all the attendees and not just the panelists, so everyone can see what you'd like to discuss. Also feel free to change your viewing settings at the top right-hand corner of your screen if you want to see everyone all at once, or if you just want to see whoever's talking, depending on your presentation preferences. And with that, I'd love to introduce everyone who's joining us today. Just please keep in mind, Assembly members are bouncing between session and today's event, so they'll be kind of in and out. But everyone should hopefully be here for some portion of time to answer all these different questions. And with that, the panelists who are participating today are State Senator Elijah Reichlin-Melnick, State Senator Shelley Mayer, Assembly Member Kevin Burns, Assembly Member Mike Lawler, Assembly Member Kevin Cahill, Assembly Member Nader Sayegh, and David McNally, the Director of Government Affairs and Advocacy at AARP New York. And with that, I'd love to start with the first question, obviously talking about the state budget, which was just finalized earlier this month. I'd love to start out with our state senators who are here right now, just starting out with a bit of an overview about highlights in the budget, and particularly any areas that affect seniors in New York.
I will defer to some of my more junior colleagues to go first.
Well, thanks, Shelley. So I'm happy to speak a little bit about the budget. And for those of you who do not know me, since I was recently elected, I'm serving my first term representing District 38, which covers about 3/4 of Rockland County, along with the town of Ossining in Westchester. So the budget, I think, actually had a lot of great wins for the residents of the Hudson Valley, and particularly for seniors. And I would start with the tax front, because that's certainly something that we hear a lot about as legislators, and so many people out there in our communities in Westchester, Rockland, and the whole Hudson Valley deal with extremely high property taxes. So the budget we passed actually provides record levels of funding to our local public school districts. And not only does that help with the students and the education they're getting, but it helps with property taxes, because districts that are receiving this funding overwhelmingly are turning around and either doing a 0% property tax change or the lowest increases in many, many years. In the district I represent, more than half of school districts are proposing budgets with 0% tax increases, and the others are at 0.1%. So we're seeing a tremendous win there. I think it's really a win-win both for our schools and our students and for our taxpayers, and particularly for seniors that might be on fixed incomes. I think that'll be a tremendous win. We also saw some great progress in the budget with respect to income tax relief. The governor had proposed delaying the middle class income tax cuts, which were set to be phased in. The final budget includes those cuts. And so people earning less than $250,000 a year should see their income taxes decrease somewhat. And we created a new property tax circuit breaker program funded at $440 million around the state, which will help people who are paying more than 6% of their income in property taxes, providing tax credits to people who are middle class, making under $250,000 a year, and paying more than 6% of their income towards property taxes. So that's just a couple of the programs that I think will directly benefit a lot of our residents. The other great stuff in there about infrastructure funding for our local communities, and really trying to invest in our mental health systems as much as we can, and local governments and things like that. But I'll defer to Senator Mayer to continue talking about some of our great policy wins in the budget.
Thank you very much. I'll just jump in if that's okay, Kay. I'm State Senator Shelley Mayer. I represent the 37th Senate District, which goes from the Bronx border in Yonkers, which is where I live, all the way up to the Connecticut border in Northeast Westchester, and includes the entire Sound Shore. I split 3 cities, Yonkers, New Rochelle, and White Plains, with the majority leader, Andrea Stewart-Cousins. And then I do have these other communities, including Eastchester, North Castle, and Bedford, along, as I said, with the Sound Shore. So a very diverse community. And I am the chair of the Senate Education Committee. And as Senator Reichlin-Melnick said, we really had a very, very terrific outcome for education and public education. And I always say it doesn't really matter whether your kids are in school anymore, because people want to move to communities where schools are invested in and schools are good. So it creates additional value in your house, and hopefully it begins to shift the cost of education to the state, as opposed to relying so heavily on property tax, which has really been just a devastating thing in our districts in Westchester and Rockland and the Hudson Valley. So we're very, very mindful of that. But at the same time, we know our kids, particularly after this year of COVID, really needed the funds we were able to get, plus the federal funds. So I'm very pleased about that. I did want to mention 2 things that Senator Reichlin-Melnick included some of the things, but on healthcare generally, I think the experience of that we saw during COVID is that the challenges in our healthcare system are great, and that there are some fundamental inequities that we need to address. We try to address some of them in the budget and some thereafter that really do affect seniors. We restored $415 million in proposed Medicaid cuts for hospitals and healthcare providers. And as someone who worked in a hospital for 7 years, I always have to remind people, as the ad used to say, there's not a Medicaid nurse and there's not a Medicaid orderly. Medicaid is part of the revenue that goes into hospitals and healthcare. And once it is cut, all services are reduced. So this was a very important addition that will benefit everyone who needs healthcare. The other thing we did is, and this is a lesson learned clearly from COVID, is requiring nursing homes to spend at least 70% of their revenue on direct patient care and 40% on resident-facing staffing. And we put $64 million in for increased staffing. So for any of us who have loved ones in nursing homes, we know the real issue is how often do they relate to a real person who is paying attention to their needs, as they would if they were home with us. And we recognize that. We put money in the budget for it, and we're actually adopting legislation that goes even further and establishes a staff ratio for nursing homes that insists that there's a certain number of hours, whether it's a nurse or a CNA, that must be attentive and providing care to your loved one. And we believe this is the right thing, the human thing. An experience learned from COVID that our nursing homes, some of them really were stepped up and were fantastic, but in other cases, there was not enough care given to individuals, particularly those with COVID. So those were 2 big issues. I would add, while it's not in the budget, in terms of healthcare and seniors, we are adopting legislation that addresses some of the nursing ratio issues in hospitals as well, with some voluntary compliance by hospitals and employees to try to ensure that we have sufficient number of nurses on the floors as needed, so that your loved one doesn't ring a bell and then wait too long before someone comes. All of us who have cared for others have experienced that. We're trying to ensure that, as we say, we have a people-focused budget that, particularly for seniors, if there's anything COVID showed us, is that we have to do a better job ensuring that our seniors are listened to, cared for, and that we adopt policies that address their needs. So I think we really made an important stride in the provisions that we adopted in the budget.
And I see Assemblymember Sage has joined us. Welcome. Our first question was just sort of giving an overview of what you all saw as highlights in the state budget, particularly in the areas that affected seniors in New York. Do you have anything that comes to mind that you'd like to share?
Yeah, sure. First of all, always a pleasure to be with my colleagues. Of course, having discussions with regards to issues that impact our senior population. And many of us, including myself, really grew up with a strong appreciation through my cultural background and values for seniors, and was very concerned, with regards to the impact, especially the pandemic has had on seniors. Senator Mayer knows, I lost my mother last April during the pandemic, and lived to the early age of 91, and was a pillar in our community. So I grew up with a system that has an enormous respect for seniors and really recognize, not only as a citizen of the community, but especially as a legislator, to really look at legislation and policies that impact seniors. And as Senator Mayer stated, the budget this year was a budget that I think all of us are very proud of. The amount of funding that we're able to, bring about for education, for healthcare, the amount of legislation that impacts senior citizen homes and nursing homes, and, as Senator Mayer stated, the 70% mandatory rate that they need to put on, services to seniors, really now coupled with even recently the legislation dealing with safe staffing is really such that, with all the tragedy we had to deal with, especially with nursing homes and the loss of life, I think, the legislative body took strong action to really assure that, that compliance related and norms and standards were addressed to make sure that at the very least, we can at least proudly say, yeah, we addressed it and put forth a system in place to assure compliance. As far as legislative bills, one of my legislative bills that I have really not only, addresses, in my opinion, a very important senior related matter, and that is with judges. Judges in New York have to retire and in many cases leave the bench at 70 years old. One of my legislative priorities is to make sure that we change the mandatory retirement age from 70 to 76. When these policies were established many years ago and the life expectancy was a lot less many years ago, it's not presently reflected in a correct way. Many people that serve on the bench, when they leave their private practices, whatever law-related practices, and they become judges at 70 years old, those of us know that in today's time with healthcare and life expectancy rising the way it is, 70 years old is very young. And to tell somebody you can't practice no more is really, in my opinion, wrong. The mandatory vaccination and testing, was another issue that all of us were very concerned about. And we lobbied heavily, for example, to get a mass vaccination site in Yonkers. That's something we were very proud of. It really focused initially, of course, on the senior population. And that was for a reason, because we knew that the older population, had a more detrimental, health-related matter than a younger person. And presently, at the Yonkers vaccination site, of course, 50,000 was in mid-April. Shots were given. Our office, and I'm sure the senators and my fellow colleagues in the assembly, was very active in helping many seniors arrange appointments at a time when it was difficult to get an appointment. We were extremely active and continue to do so with many seniors in our district who had food-related needs, and our office staff, really went into the homes of many seniors and provided necessary food, and visitations whenever was necessary. So I know there's time restraints and so forth, but these are the type of legislative initiatives. There's many confronting us in the Senate and the Assembly, and of course, these are the type of concerns that really relate to seniors, in addition to some 8 utility bills that deal with utility companies making sure that they address emergency needs, especially during hurricanes and weather related. And these legislative packages deal with seniors in need that may have health related needs, assuring that emergency services, fire, police, EMS are equipped that with backup resource energy, so that in the event there's a cutoff of energy, that after 2 days, there's a mandatory requirement to make sure that power is restored, especially those with medical needs and those providing emergency services. So, but as we go on, we're still in session, by the way, senators, so I may have to run back and forth, but if there's any questions, please don't hesitate. Thank you very much for the opportunity.
So just jumping in to say, welcome Assemblymember Cahill. Glad that you could also make it in as well. And David, did you have something you wanted to add?
Well, I thought I'd let the legislators, I wanted to make sure we get to hear from each one of them, but I can say a few words about the budget if you want me to do it now or at the end.
Let's loop back. I did want to follow up on what some of you guys have already discussed, which is the issue of long-term care reform, and some of the things that have already been discussed in the budget, some discussions that are happening now for reform possibilities.
So,
Go ahead, go for it, David. Just was interested in getting thoughts on what should happen next.
So there were some great things in the budget this year that we want to thank the legislature for, that we were fully supportive of, and we were so excited to see them come to fruition. The senator mentioned the 70-40 nursing home issue, making sure the money is being spent on direct care. We thought that was a great win, along with all the other nursing home related advocacy that we've and other groups and the legislators have been doing to achieve a lot of reform. Recognizing the need to get accurate internet mapping. That was an important win in the budget. And a lot of people say, what about seniors or older adults? Our organization is 50 plus. That means broadband and telehealth are so important for health, fight social isolationism, work from home, stay connected. So it's a huge issue for our membership, which is 50 plus, which runs the gamut, of course. And of course, having the low income benefit created, that was fantastic too. The legislature restored money to kin care programs, which are programs few know about, but would desperately want if they needed it. And those are programs of non-parent relatives raising children. So there was a lot of great things in the budget. There was an $8 million add to the programs that run through the State Office for Aging that allow people to stay in their homes. And we very much thank the legislature for the $8 million add. That's all very great news for older adults. I will say, however, the $8 million add, we thank everyone so much for it. However, it really is not enough to end all the waiting lists that are at the county level of people who are looking for these small services so they can stay in their home and out of nursing homes. The organization of the area agencies on aging, those are your county offices for aging, who know this issue the best, who are the ones in many cases keeping the lists, having to say to people, I'm sorry, we don't have the money to fund that for you right now. They said there were about 11,000 people on that list, and it will cost $27 million to get them all the services they need. 8 is a great start, but that means over 2/3 of that 11,000 are still waiting. So I don't mean to be the skunk at the garden party, because there was a lot of great things in the budget for older New Yorkers, and we thank the legislature for them, but I wouldn't be doing my job if I didn't mention a few things that are still undone that we're looking for.
Yeah, thank you for sharing that, and definitely, want to touch on a broad range of different issues, affecting seniors in New York. As I mentioned, we've discussed the long-term care issue and how to best reform nursing homes, best reform assisted living facilities, provide home care services and so on. For you all, do you have any sort of priorities looking at, other measures that might be taken to make long-term care even better in New York? I know Senator Mayer, we discussed some issues you were working on. Do you want to take this one?
No, I want to defer to Assemblyman Cahill because I think he has to go back to session. I apologize, but that's how we try to treat our colleagues.
Yes.
That's how Senator Mayer treats her colleagues. I wish we all did the same thing, and it's a great pleasure to be here. And I will not take up the opportunity to to start to dominate the conversation. I will say that you've never seen a legislature, including the federal legislature that passed the Affordable Care Act, so focused on healthcare as there is in Albany right now. I would have to say the last time you saw a legislature this focused on healthcare was in 1965 when the federal Congress was passing Medicare and Medicaid and making it the law of the land. We are determined to develop universal access to care one way or the other. And universal access is not just about making sure everyone has insurance. It means that everyone should have access to quality care. It should be affordable, yes, but it should also be available, and it should not discriminate based upon the source of payment. That means that we have to fix our system. Probably my focus has been the continuum of care since I came from this field in the past, and I recognize that healthcare is full of cliffs. It's full of places, and Dave, you just identified one with the folks that want to stay at home, and we don't have the resources to keep them there. We don't have the resources to properly discharge people from hospitals. We don't have the resources to properly service people at rehab centers. We don't have the resources to fully staff our nursing homes and to make sure that they are safe places, as we witnessed early on in this pandemic. We have a lot to do with healthcare. I frequently said to my local hospitals, a sound business plan is not coming back to the legislature and ask us where the next grant is coming from. We have to put our healthcare systems on a stable footing, and we're determined to do so. I'm very fortunate to have the perch of being the chair of the insurance committee, which puts me somewhat in oversight of some aspects of healthcare, but not all of them. Rest assured. Even more fortunate than that is that I'm a colleague of Richard Gottfried, who is our senior member of both houses, but also someone with such deep knowledge of healthcare and so fluent in every aspect of it. Even though we frequently disagree on certain aspects, I'm so grateful that he's there. But last and not least on this equation of what the future holds, I've been in the state legislature for off and on, because once in a while the voters told me to stay home. For 25 years. And I can tell you that the last couple of years have been the most gratifying, the most productive, the most meaningful, the most forward-looking years that I've experienced. And I had great relationships with my Republican colleagues in the Senate, and I still have great relationships with my Republican colleagues in the Assembly. But to have the shared progressive leadership that Senator Reichlin-Melnick presents, that Senator Mayer, who unfortunately left our House but went to the Senate and gave them the leadership that they needed there, that we get from Senator Harcum, Senator Hinchy. The Hudson Valley is very ably represented, and as a result of that, the sensibilities that we have are coming to the fore. The needs are coming to the fore. I said that was last, there's one more last. And that is that I can tell you how for so many years I have relied upon the good advice and counsel and actually toured the state with AARP to advance. Back then it was energy measures, but since that time I rely on your good counsel when it comes to healthcare measures. So with that, I'll turn it back, and I'm very anxious to hear what Shelley has to say about her priorities, because quite frankly, whatever Shelley Mayer's priorities are usually are the rest of ours too.
I'll just jump back in. Thank you. What I was going to talk about, two specific issues that I care deeply about that involve seniors. And I do want to thank AARP before, as Kevin said, because on the issues of nursing homes this year, which obviously charged up, very, very challenging, AARP continued to be in the lead. It's never easy to be in contentious situations here during a COVID, but the impact of COVID on seniors, and particularly on those in nursing homes, is a problem that we have to learn from. And thank you to AARP for your leadership. One thing I've been looking at for a long time is long-term care insurance, which I believe is something that we ought to have that really works for people so they can stay home. But what I have had repeated complaints from seniors is they paid their premiums all these years, and then all of a sudden the premium goes up exponentially. They cannot afford it. And therefore all this, the planning they were doing to stay home and stay out of a nursing home is irrelevant because they don't have any alternative and they have to become Medicaid eligible if possible. So I'm working on a bill, as I have for some time, to require the Department of Financial Services to make rate decisions based on the best interest of the policyholder, a broader standard, and to require much more public disclosure, because people are told up front, oh, your premium's never going to go up, but then it does go up. So we have to, there are challenges in that industry, and Kevin knows better than others, because it's hard for them to stay afloat, the insurers. But I believe that long-term care insurance is one of the saving graces for our seniors who wish to stay home. We have to develop a better product. The other thing is, someone asked in the question here about the non-nurse caregivers, what usually called the CNAs. And this group of people is so important to all of us on both sides of the aisle. These are our constituents who have these jobs, the lowest paid jobs, generally women. If you're in my district, you see them on the bus all the time because they generally can't afford a car, going to nursing homes, hospitals, people's homes. We have this year started a really robust effort to get them in the Hudson Valley to be paid more, to have a higher base salary. And that effort that was led by Senator May in our House, who's from Rochester, and was really the beginning with the Assembly of a focus on these lower paid women who are so essential when you're in a hospital and nursing home. And they have to be paid better than they are and have a path forward. So while we did not achieve success in the budget, we really got our foot in the door on this issue. And I think next year we will, together with the Assembly and Senate, and again on a bipartisan basis in the Hudson Valley, really focus on largely these women getting a living wage as opposed to being paid less than they would at McDonald's. That's a very important issue to me, and I know to my colleagues as well.
Right. And, I'd love to open it up in case, Senator Reichlin-Melnick has any thoughts on this as well. But, also, ready to touch on anything else. Senator, anything else you'd like to add on long-term care reform and related issues?
Absolutely. I mean, I think Senator Mayer and Assemblyman Cahill said it very well, but certainly with respect to fair pay for people in this industry, it's incredibly important. That is probably my biggest disappointment with the budget we just passed, is although we were able to, I think, make historic investments in so many aspects of our state and services that provide, vital aid to people across New York, we were not able to get in there the fair pay provisions for home care workers, for people who are serving, people who are homebound, people who have no other place to go, and being able to keep them in their homes and not need to go into a nursing home. And I think these are folks, as well as Senator Mayer said, who they are losing jobs to, they're facing competition from fast food. And you could get paid as much flipping a hamburger as taking care of a senior and keeping them in their home. We need to incentivize people to stay in this field. There's a huge demand for services like this, and try to keep people out of nursing homes if they don't have to be there. And so I continue to prioritize that. I hope we can get it in next year's budget and do as much as we can on that front. And with regards to the staffing issue, which was touched on, this is going to be a huge win. We're debating it, I hope, and having it come up in the next few weeks, but I know there's been ongoing negotiations with the legislature, with hospitals, with nursing homes, trying to work out an agreement we can all get behind that will really improve the ratio of care and make sure, as was said, that if you need assistance, if you're there in a hospital, if you're there in a nursing home, there will be somebody to assist. We won't have these cases where hospitals were unprepared for COVID, nursing homes were unprepared for COVID. They did not have the staff to serve the patients that they served. We need a better solution, and I think we're going to get there pretty soon with this safe staffing legislation that's being advanced.
If I could, if we're on long-term care, looking forward, another option are accelerated dwelling units. Sometimes they're called granny pods or mother-in-law apartments. They increase affordable housing. They convene a living situation conducive for the family caregivers. They allow older adults to stay in the community. And I just happen to have a bill that we're going to be asking people to become sponsors of. So I hope you'll all consider becoming sponsors of S4547, that's a Harcum bill, and A4854, which is an Epstein bill. And it would require zoning and around the state to allow these units. They can be either inside an existing structure or adjacent to. And we know older people would seriously consider living in that arrangement. And our goal is to find ways for people to age with dignity in places they are comfortable and want to be. And we know from our research, this is a place people would want to be, and the family would like to have the option to be able to have that person there as well. So
Dave, if I could jump in on that point, Dave, just for a moment.
Yeah.
The city of Kingston, the city in which I live, is considering local legislation that would reclassify single-family houses as single-family houses with accessory apartments. So essentially legalizing for the entire city of Kingston the ability to put an accessory apartment in. It's actively being considered. I would just add to that, by the way, that it's all well and good to have places for people to live, and it's all well and good in particular to have single floor places for people to live that give them access to everything that they need. But unless and until we improve the availability of home care services, even that's not a good option. A few years ago, I got involved with the local ARC, who were providing services largely to the adult developmentally disabled population. And we put together a pilot program with a career ladder that changed their rotation of staff from 40%, over 40% a year, to down to about 14% a year. It provided a career ladder, it provided a slight bump in salary. It provided hope and an opportunity for a future that doesn't exist with home care right now. And until we take it as seriously as it is, until we treat it as seriously as it is in the budget, we're still going to have that gap. So while I applaud that effort, and I wish you luck across the state, it's one piece of the puzzle that it's also going to require adequate staffing at the home care level as well.
There certainly is no silver bullet, but this is an important piece, we think. I will tell just a quick personal story. When my parents needed caregiving, family caregiving, they spent a winter with me in my 1,000 square foot home, and with one bathroom, and they would have jumped at the chance, as frankly probably we would have too, to be living out in their own little unit with their own bathroom where I could be checking on them all day long and in the evening. So yes, absolutely, we need the paid caregiver. We need career tracks for them and to be paid enough that we can get the people to do those jobs. But the accelerated dwelling unit would also be, of course, for the family, to help the family caregiver as well. But I completely agree with you, Assemblyman. Thank you for that.
And I'm glad to see a lot of attendees are very animated on this, hoping to get some more of the audience questions in towards the end of the event. But for now, to pivot on to a bit of a different subject, retirement security remains an issue for a lot of New Yorkers still. Not everyone has enough retirement savings. They don't necessarily work for employers who provide pensions, 401ks, or other such options. Where are you guys on thinking about, legislative approaches to tackling this problem?
Well, I'll just jump in to say that I think for myself and many of my colleagues in our majority conference in the Senate, we recognize that unions have provided a path for people to be able to retire in some kind of security because of a pension. You think of people who work, as we've said, in some of the group homes for the developmentally disabled that are run by the state of New York. And while the average pay of many of those folks is modest in comparison to some others, the benefit is that they have a pension. And we will work hard to preserve pensions of public sector and other employees. Some of that is regulated at the federal level. But I think time and time again, we recognize that collective bargaining agreements that includes pensions and an opportunity for people to retire is one of the missing links today. People have jobs without a pension, then they retire. They have their home, maybe, as I say, they're home rich and income poor. They live, for example, in my community where they bought their house many years ago for $35,000. Now it's worth a lot more, but they can't afford the taxes. And they, other than Social Security, they do not have a retirement pension unless they were a teacher, a plumber, a teamster, a cop, a firefighter. And so There was a tendency to really devalue these jobs. And I think the governor, to some extent, has outsourced jobs that belong to the public sector. And we have fought hard on behalf of public sector employees to make sure that as much as possible, they have a chance to stay in the workforce, gain a pension, which usually comes with health insurance benefits in retirement, very, very essential to supplement Medicare. And we will continue to fight for jobs with pensions and benefits. We recognize it's a tough time for business, but it's also a time for shared sacrifice. I think that's one thing this COVID pandemic made clear. And we need to bring everyone up and not just let the folks at the top do extremely well and the rest of the population really suffer. So I think we haven't dealt extensively with pensions in the budget because most pensions are regulated at the federal level. But to the extent there are public sector jobs in New York, I think we're very committed to retaining as many of them as possible with good pensions so that people can retire and have health insurance.
So
And I would just add to that, although it isn't a state, we don't regulate Social Security, we don't make the laws on Social Security. I think there's a clear need, certainly for our federal representatives, to fight against any cutbacks on Social Security, and honestly, to look at the benefit levels, because when the program was created at this point, 85 years ago, it covered, it covered much more as a share of what people could afford. And inflation has eaten away at some of these benefits. And although there are COLAs and cost of living adjustments that are put in there, I think that most seniors in our state and in our area would say that these cost of living adjustments, they don't keep up with the real cost of living increases. And, so I certainly encourage our federal representatives to stand strong on Social Security and look for ways to extend this program and extend the benefits to help people make ends meet.
I'll just pipe in, Dave. I know you're anxious to move on to the next piece, but I never miss an opportunity to be proud to be a New Yorker, and particularly to be proud to be somebody from the town I'm in. In 1935, President Roosevelt signed into law the Social Security law. And at the time, he did so because there was a huge gap between the haves and the have-nots. That gap has only grown. The Social Security system was intended to cover just a few years of people's retirement to give them some financial security. The age of retirees has extended tremendously, and there's a great need. We in New York State started it. It was Francis Perkins from upstate New York, and of course, my favorite hero, my all-time political hero, Arthur Fleming from Kingston, New York, who also created the Medicare program. And those programs were bold for their time, but they are needed now more than ever. Yes, the federal government has a responsibility for pensions, and quite frankly, they're not doing a very good job of it. Many, many pensions have gone south, including my own dad's. He passed away a long time ago, but in the last years of his life, he had no pension because the pension had gone belly up. We're seeing the same thing happen even with public pensions like Stockdale, California. So we in the legislature are very careful to recognize the stewardship that's invested in our comptroller, Tom DiNapoli, on the public pension, but we also recognize that there's a growing need in the general public to deal with this. I would certainly entertain the possibility, I think, Kay, this is what you were getting at, of opening up our pension systems to allow non-governmental employees to participate in them in an appropriate way. And for those who fear that it would damage the system, let me just tell you, this is exactly what I did when it came to Uber drivers, when it came to ride-sharing drivers. They couldn't participate in the workers' comp program, so we put them instead in the Black Car Fund, and both entities thrived and prospered because of it. We can do the same thing. It's certainly worth our looking into, but we are very attuned to the needs of financial security of seniors in this state and doing all we can to advance those opportunities. And Dave, you are chomping at the bit. Go for it.
Sorry, someone. I want to catch it before you left so we could thank.
Oh, you're muted, Dave.
You just muted yourself.
So for most of everyone who was in the legislature who's on this screen, I thank you first in 2018 for passing what we were calling Work and Save, now we call Secure Choice. It was a program for employers to offer to their employees that did not currently offer anything. It has been, there was 3.5 million that had no way to save at the workplace. And so the legislature passed it. It's been delayed a couple of years in implementation. And while it's been delayed, there is now an effort to even make it better. So I have a bill number for you. Assemblyman Rodriguez he was the original sponsor of this bill, and he's now put in a new bill to make it even better. It's A3213A, and it would require all employers to offer this if they don't already offer something. And it would also be opt-out, meaning employees would automatically be signed up when they start work, and they could choose not to participate. Right now, it's if you want, you have to sign up when you're an employee. We know both of these dramatically improve the efficiency, effectiveness, and the number of people who are participating. So we're hoping to get this bill A3213A done this year. So before the whole program gets stood up, it is a stronger program. The similar programs with similar components have been wildly successful in California. It has withstood safe harbor provision fights at the federal level. And we believe, frankly, elections have consequences. And we believe the climate now to have support for this at the federal level for the states to do is vastly improved. So I want to thank all the legislators for supporting the original bill. And before the program gets up and running, I ask that they make it even better by making it opt-out for the employee and mandatory for the employer. And when you hear mandatory for the employer, obviously everyone always says, oh no, more cost to small business. There's virtual no cost to this. If you use a payroll company, the cost to the employer really is adding an extra line to deduct from their payroll slip, much like they already deduct their insurance or their Social Security or whatever other deductions are being taken. So, and we're finding that many employers think this is a great idea. It relieves them, frankly, of the burden of having to come up with a new system that will cost money to implement. And so as far as being competitive in the market, here's a great option to be able to offer to potential employees saying, we offer this. So we think it's a great idea. It's working gangbusters in other states, and we really hope the legislature will improve it before it gets stood up.
With that, I'd love to welcome our two other assembly members who are able to join us now. It's good to see you all. Right now, we're talking about, ways that New York could potentially better support retirees who, maybe don't have enough savings, need better support. Don't want to put you guys on the spot, but would either of you be interested in talking about, some ways that the state legislature you think or the state could, better support people who need better retirement savings, is that what sort of approaches could be taken to help?
I guess I'll start. Okay, thanks for having me, Kevin Byrne. I represent a slice of northern Westchester, the towns of Yorktown, Somers, and much of Putnam County. I was able to listen to a little bit of the previous discussion. I didn't have my camera on because we were still in the middle of session. I had to listen to our colleague, Mr. Zabrowski from across the river, give a very passionate remarks and speech on a privilege resolution. Mr. Lawler spoke on it as well for a gentleman from Rockland County that lost his life in the line of duty, volunteer firefighter. But I'll just briefly talk, if you don't mind, about the budget, because when we talk about spending, I think, and we talk about affordability, I think you have to talk about it, at least to some extent, in the context of the budget. And I come at this from a different perspective than probably most of the legislators that you've heard from before. The budget was $212 billion. I think the first time I got elected, 2016, my first budget in 2017 was either 153 or 157 billion dollars. So significant increase. We often in Albany like to highlight the property tax cap. I bring that up because it seems pretty clear that our Albany spending isn't staying within that same type of guideline. And every time we spend dollars, it comes at a cost, and that's usually with taxes. So we did see increase in taxes on high income earners. We saw increased taxes on corporations. And a lot of my colleagues come from a different philosophy and perspective in government, and that's perfectly okay. And it helps fund different programs that people are very passionate about. But we also face other challenges. I mean, tax migration, I believe, is a real thing. But it's not just about people voting with their feet. It's also about the ability to create new wealth, new jobs, new opportunities for people. So we can bring that here in New York. The big news yesterday, we lost another congressional district after the census. So I think 10 years ago, we lost 2 congressional seats. This is another one. So as we hear people talk about how we need to rely on our colleagues in Washington, D.C. for support and for help, which they are 100% right. We do. I think the more clout and influence that we have in Washington, D.C., the better. So losing representation down there is not a good thing. But I look at affordability again for all folks, for our young people and for our seniors. We want to make sure that we protect what they have earned so far, right? We want to make sure that there is affordable housing. I think the last time I spoke to this group, it was I think last year, and we did this, and I highlighted the fact that in the village of Brewster in Putnam County, we have a great nonprofit, the Putnam Community Foundation, that provides affordable housing for seniors. And they had a great partnership years back with support from the state. So I think that's a good example of how we can try to attract affordable housing and keep people here living in New York. But it does go to affordability. It does go towards the cost of living, economic opportunity for their children. I want their children to stay here too. I want your members, their grandkids. I want them to be able to stay in New York, get a job in New York. I'm going to go, if you don't mind, if you'll indulge me, just because I know we don't have so much time and I just kind of jumped in late. Some of the discussion that you wanted to talk about what our priorities are. I always talk about tax relief. I always talk about jobs, ethics reform. Anyone that's following the recent news, I don't want to open up a whole can of worms here, but with the executive branch, I think we need ethics reform more now than we've ever needed it before. And public health and safety. We're living through this pandemic. We've made some really good things. I'll say the budgets are always a mixed bag, but we did protect against some of the really dangerous cuts that were proposed by the executive. So that was some good things. We restored a program that was, I think, this is not a criticism on my colleagues here on the call, but it was shamefully eliminated in last year's budget that helped people with cystic fibrosis who actually came off the Medicaid program and wanted to work. So this budget actually restored that in part. We've done some other things, expanded telehealth. I think that helps provide opportunities for seniors and for everybody else. But I'm getting long-winded here. I want to make sure that these all of our seniors have more opportunities to stay here with their families. So one of a big piece of that is affordability and protecting their pensions and providing more options for them to stay here in New York.
So if I may jump in, I apologize coming in late. As my colleague mentioned, I spoke on the floor about a resolution honoring a fallen firefighter. I'll just dive into two important things. When I ran for office last year, I really focused in on affordability for our residents in Rockland County. I live in Rockland, which property taxpayers pay, depending on your study, between the first and second highest property taxes in America. We may have surpassed Westchester, which is a scary thought, but it's primarily driven by two things. It's driven by Medicaid costs and it's driven by school taxes. And so for a lot of our seniors, the cost of these programs and the amount of money that we invest at times can really be difficult for them, especially when they're living on a fixed income. And so I think there's a few critical approaches. And I talked about it when I was running and I've introduced legislation to address it. Number one, I think the state needs to do a takeover of Medicaid and get the cost of Medicaid off of our property taxes, which would help our seniors especially. And number two, and I was glad to see in this budget, it was one of the few things I did vote for in this budget, was the increased aid to our schools, which does help alleviate, property taxes for our seniors because our schools are getting more funding, which helps alleviate the need for tax increases through property taxes. But one of the things that I've put forward is a change to the regional cost index. I know some of my colleagues have done work on this. Senator Mayer has held hearings on it in the past. I believe Rockland County and Westchester specifically are severely shortchanged when it comes to the regional cost index and the labor coefficient. So I've put in legislation to change that, which this year alone would have provided an additional $11 million to our schools in Rockland County, which really would provide direct relief to property taxpayers, especially our seniors who are living on the fixed income. So, as we move forward, I really do think two of the most important ways to help make New York State more affordable for our seniors is to really tackle the issue of property taxes, and that starts with Medicaid and school taxes, and how we find real ways to ease that burden on our seniors. And so that's something that I've really been working on. And then on a local level, obviously the issue of affordability is critical. And when I was deputy town supervisor in Orangetown, the town of Orangetown really worked very hard to maximize PAC zoning, which allows for 55 and older communities. And the good thing about that is it creates new housing opportunities for our seniors so that they can get out of their single family homes, which also opens up new housing stock for young families to move into communities. And I think across the state, that's something that all of our municipalities should be looking at to help ensure that there is affordable housing opportunities for seniors to move into so they could stay in their communities and not feel that they have to move to, North Carolina or Florida or other areas of the country where they've been moving, in part because of the high cost of living and the high cost of maintaining a home, a single family residence, as opposed to maybe moving into, a townhouse or apartment that maybe is a little more affordable. So those are some things that we continue to work through, and those are some of my priorities to help make sure that New York State actually becomes more affordable for our seniors.
And just to jump in, since we're running down toward the end of the event, I want to make sure we can get to the many audience questions that have been submitted. I'll start from the top because a lot of people seem to be curious about, everyone's perspective on the Medical Aid in Dying Act. I'd love to hear, all of you legislators who are joining us today, what's your feeling on this legislation? Is it something you'd support or not? What's sort of your reaction to the legislation?
I guess I'll start. I'm on the health committee. We actually have not had a vote on this in quite some time, since before I was elected. I think the last time, maybe 2015. So I got in there in 2017. I don't support the Medical Aid in Dying Act. Obviously, I have compassion for folks that are going through terminal illness. And I can understand, loved ones watching someone that they care for so deeply go through something so traumatic and so painful. I just don't believe that is the option that we want to be, whether it's indirectly or not, be trying to put out there for physicians when they have a Hippocratic an oath to do no harm. I would rather do more to try to promote and highlight the use of advanced directives so people are aware of all the choices that they do have. So people, when they are in this awful situation, that we don't complicate an issue by going through additional medical procedures that are unnecessary or that their loved one would not want to go through.
Assemblyman, go ahead. Okay. I think this is it's a very tricky issue that people of conscience on both sides of the issue tend to have very strong feelings about. I know there are a number of our major religious organizations that have very strong feelings about it, and it becomes an emotional and kind of conscious issue for all people. I have to say, in reviewing the legislation, I'd like to review a little bit more closely, but in concept, I think that if done right and properly put forward with the safeguards to make absolutely sure that nobody is pressured into doing anything, because people raise many serious concerns to ensure that people with disabilities are not feeling pressure. People do not feel pressure from their family, that there are proper safeguards there. It's something which conceptually I certainly could see a way forward on. I just would want to review the specific text of the language for the bill. I'm a new legislator, as I mentioned at the beginning, just took office a couple months ago, but it's not something I would reject out of hand at all.
May I just chime in? The senator actually brings up a good point. It is getting really, I don't want to get too far into the weeds with this, but if you're prescribing the like prescription, for lack of a better term, that's going to end that life, there are a lot of concerns about how that could be accessed or used unintentionally. So there have been concerns raised about all those other technical arguments too. I mean, I think I gave more of just my personal opinion on it, but there are a lot of technical concerns as well that have been raised.
So I'll jump in very quickly. I share the view that you've heard so far, that there's a lot of compassionate reasons to support it, but there are a lot of technical issues to consider. Let me be clear, this is my dad's birthday today, and yesterday was the anniversary of his passing. He never had a 51st birthday, but the last 4 years of his life were just unparalleled suffering. So I certainly understand why someone would choose a compassionate ending of their life as opposed to days, weeks, months, even years of agony. People deserve dignity. I've not been a supporter of Assemblywoman Paulin's bill, however, because I don't believe it does include the appropriate safeguards. What I have done instead is I've advanced my own bill, and that's Assembly Bill A198, which would call for the Department of Health to study these measures across the country and across the world to determine what issues exist and what issues need to be resolved. And I'll be honest with you, it's a big topic in my community, particularly with some of my older constituents. And they consistently said it's been studied to death. I respectfully disagree with that. There's a lot more study that has to be done. One of the concerns I have, and it's only one of the concerns I have is that with two disinterested parties, if there's one that's willing to do it in every instance, now it's only one disinterested party. My colleague from the Senate pointed out the issue about people with disabilities and people who might not be fully capable of expressing their own will, even though legally they would be allowed to do so. Another concern I have is the cocktail of drugs that would be prescribed for this purpose. In many instances, the drugs that are used in other states are the very same drugs that are used to administer the death penalty, and they have failed in those states and have caused great agony for the people who are using those drugs. That doesn't mean we shouldn't move forward. It doesn't mean we have any right to deprive people of making compassionate choices in their life. And I don't have a philosophical opposition to the concept, but I don't believe that we are ready as a state to move forward with it. So that's why I would support and ask for my colleagues to join me in supporting Assembly Bill A198 so we can actually have that information from an objective third-party source, our Department of Health, who we charge with responsibility for these issues, and let us then have that information available to the legislature so we can make an intelligent and learned decision.
I agree. I agree with my colleague, Kevin. You know, it's an issue that's been a very difficult issue. And, you know, from one end, as I said earlier, the impact seniors and grandparents have had on me growing up and how much value in making sure that the health and well-being of the senior population and the disabled, that every option is given from the healthcare perspective, from the cultural, from the support, to really give opportunities to support life and value life. And in very severe situations, when this issue came up and severe situations were presented, you know, yes, I had a tendency of saying, yes, in those very severe circumstances, you want to give someone an opportunity. Although you may not personally agree, but we live in a society, we live in a democracy. But having said that, I agree with Kevin that I want to make sure that whatever legislation we approve has an enormous amount of safeguards and standards that at least assure us whether it's available, making available counseling and making available other support services, so that at the end of the day, when a decision is given to someone to terminate their life, you know, I want to be assured that it wasn't out of frustration, out of anger, out of other factors that could have been prevented. So that's where I stand on that.
I think just to piggyback on that, I was 26 when my dad passed away at the age of 54, and you know, he had melanoma that metastasized everywhere throughout his body, and you know, ultimately, when he made the decision that he no longer wanted any treatment and as things progressed. Ultimately, obviously, he was in the hospital, and the nurses and doctors gave him morphine to keep him comfortable, and obviously, to some degree, speed up the process, if you will. And I think the biggest thing to me in looking at this type of legislation is to just make sure that the individual whom it will obviously impact is the one making the decision, and the one that of clear mind is making the decision, and that it not be used, certainly not on anybody with developmental disabilities or cognitive issues, to make that decision for them. And I think, that's when we're talking about legislation like this, I think obviously it's serious in what the end result is. It's serious in what is to be considered. So that, we do already have obviously some level of compassionate care and aid in dying, and through doctors and nurses helping patients at the end of life. But I think obviously if we're going to make a decision that legalizes this type of legislation, we really just need to make sure that all the safeguards are in place, and that at the end of the day, the person who will be ultimately losing their life is the one who is making that decision, and no one else.
I hate to cut in, but it looks like we're all out of time for today's event. But thank you so much to all of our panelists for participating in today's discussion. Thank you to AARP for participating or sponsoring the event. And thank you so much, especially to our assembly members who've been balancing session and joining in on the event. If you are, feel like you need a little bit more AARP sponsored series content, we have another event coming up on Thursday, April 29th at 10 a.m. With a special focus on Manhattan and Staten Island. And we also have some other upcoming events that we'd love for you all to join. We have one tomorrow with our sister organization, New York Nonprofit Media, celebrating our 40 under 40 nominees in the nonprofit sector. Registration's free and on our website. And also feel free to join us on Tuesday, May 18th for our annual Digital New York webinar at 1 p.m. Thank you so much, everyone. Hope to hear from you soon.